Dental bridges are an everyday procedure utilized to repair missing teeth. They are made to bridge the gap left by teeth that are missing and usually consist of several crowns which attach to adjacent teeth to opposite sides that gap. There are a variety of reasons bridges for teeth are suggested by a dentist. The most frequent motives is to enhance the look of teeth and the smile. Teeth missing can cause difficult to speak and chew correctly, and also impacting the alignment of remaining teeth. Dental bridges can assist to restore the natural form and appearance of teeth and enhance overall dental health. Another reason why a bridge for teeth can be employed is to stop the teeth that remain from moving from their correct position. If a tooth has been lost, the adjacent teeth may begin to move into the vacant space, which can cause alignment problems and problems with bite. Dental bridges can assist to hold the teeth in their place and help maintain the correct align of the bite. Bridges for dental use can help in distributing the force of biting and chewing equally across the teeth. If a tooth has been lost, the remaining teeth could bear the brunt than the impact of chewing. This can cause damage to those teeth. Dental bridges can assist in distributing the force more evenly and decrease the chance of injury to teeth that are not affected. There are a variety of types of bridges for dental use that can be utilized based on the particular requirements of the patient. Dental bridges that are traditional are the most popular type. They consist of two crowns which attach to adjacent teeth with an artificial tooth between. Bridges that cantilever are utilized in cases where there's only one tooth adjacent to the bridge. Maryland bridges rely on a metallic or porcelain frame to support dental implants. To get dental bridges in most cases, patients require a visit to the dentist several times. In the initial appointment, the dentist will prep the teeth adjacent to them by taking away some enamel in order to create space for crowns. The dentist will take impressions of the teeth that will later be utilized to design the bridge using the dental lab. The next time you visit at the next appointment, the bridge for dental use is fitted and adjusted to ensure that it is a perfect fitting. The bridge can be temporarily bonded in so that the patient can test it and make any adjustments needed. When the appearance and fit of the bridge is satisfactory, the bridge will then be fixed in its position. When you get a bridge for your dental, it is crucial that patients take good dental hygiene care in order to avoid damage to the bridge as well as surrounding teeth. It is important to floss and brush frequently and avoid eating foods that are sticky or hard, which could damage the bridge. Regular checkups of your teeth are crucial to make sure that the bridge is in good shape and also to resolve any problems which may occur. Dental bridges are an everyday procedure utilized to repair missing teeth and to enhance the appearance and functionality of teeth. They are able to help prevent the teeth remaining from moving from their normal position, spread the force of eating and chewing evenly, and help improve the form and look of your smile. If you're missing teeth and are considering the possibility of a bridge for your teeth, make certain to speak with your dentist about the most appropriate option to meet your requirements.